Supervisor Beatty. Any additions or corrections to the minutes? All right, then all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. And because we don't see Rob just yet, we're going to start with Jeanette.
Right here.
Oh, where is he? Oh, okay. I was thinking that was wrong. Kind of overwhelming. Sorry about that.
All right. Is this okay, or am I too far from the mic?
Uh,
Oh, I'll move.
Maybe try that. Right.
Yeah, you might, yeah.
That's probably better, Rob.
Yep. Okay. So
Morning.
let's see. So I just have the one resolution request.
Right.
And, what I'm trying to do here is we have some funding that we have for youth respite services. These are mental health respite services. And we currently have it broken out in some different amounts, trying to estimate like how much might go to one agency or another agency.
Right.
And we've had some difficulty in, first of all, finding the availability of respite. So we might have a contract with somebody, but they don't have the staff to provide the service. So anyway, what we've done is we've identified that we want to amend this resolution that we did at 5/33 in 2021. That identified some different respite providers at different amounts. What we want to do is really just put them all in one pool and then manage the funds out of that pool so that we have staff in our office. Linda Wright is our children and youth SPOA coordinator, single point of access. She manages the process anyway.
Right.
So she matches, when somebody needs respite, she matches them to an available provider who maybe has staff and availability to provide the service. So we would want to just manage all of these within one pool of funds and just draw down whoever needs it can get it. And they voucher for the service. And she wants to add a couple of different providers on there as well. Cassius is a provider the DSS currently works with as well. And then Rose House and Big Brothers Big Sisters. So that's the request.
So, all right, would someone like to make a motion to approve that request? Supervisor Hogan, seconded by Supervisor McDevitt. Does anyone have questions for Rob? Supervisor Hogan.
All of the additional providers are, you're piggybacking those?
Yes.
We don't have to. Okay, thank you.
Any other questions? We'll vote on it. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, and then just in terms of any updates, program update, I just wanted to keep folks updated that we are exploring with Northern Rivers possibility of them going to 24/7 operations. That's our mobile crisis team. Some discussion going on as well in the Public Safety Criminal Justice Committee. So we have asked them to provide a proposal, what it would take to go to 24/7. We were hoping, this is Linda Wright from my office, our children and youth person. So we've been exploring with them the possibility of going to 24/7. To be honest with you, they're going to provide us with the proposal, but I think that one of our largest sticking points with it will be workforce, because we're already experiencing a workforce crisis within the system. We can't find social workers to staff clinic programs during the day, let alone,
24/7.
mobile crisis overnight, midnight shift type of thing. So we'll explore it and we'll keep looking at it, but I think that'll be one of our challenges.
Thank you. Any committee member have a question? Supervisor McGowan?
Thank you, Chairman. Rob, the other, last week at our board meeting, the board meeting, I think it was, to Mary, came in from the hospital.
Mary Shannon, yes.
Really touching speech she did. You know, bed shortages, and I know you're feeling the heat too. Is there anything we could do to combine and so we all can help each other? I mean, I said to her afterwards, you know, I'm usually a pretty calm mannered, easygoing guy. The pressures that are accumulating out there for even a mild mannered guy like me, you know, sometimes gets me on edge, you know, and that's not me, but I could feel the pressures coming from all over. So, you know, really, it's a tough thing. It's really scary. So is there any, you know, something that I just thought I'd bring it up. I don't know if you saw it.
Yes, I
maybe you
did.
You know, it was just touching, but they have what, 7 beds? They could use, you know, at least 17, if not 20.
Yeah, I think she was talking about putting in an ARPA request. And, you know, I mean, we'll take a look at it like we'll look at everything else.
But really, I wasn't really, sorry, excuse me, I'm not really looking at money or the ARPA, but
Okay.
really just, you know, what we can do as a team to work together. I know, you know, we're the county, they're the hospital, you know,
Yeah.
it's 2 different things, but, you know, you've been doing this a long time and I respect what you do. I'm just really concerned that the road that, you know, the whole country's heading down and whatever we can do to work together.
So we do work very closely with the hospital. Our community services board has subcommittees for mental health and addiction services. They sit on that committee. We've established a crisis services committee in the county too. So all the crisis services meet together, including the hospital. So we work very closely with them. First of all, trying to reduce, you know, the traffic to the hospital, trying to divert when we can. But also, you know, we work frequently with them on individuals that end up there. And Linda works with them all the time. One of the biggest challenges is children finding beds. You know, if it needs an inpatient bed, there's a shortage of beds. So, you know, when we talk about the workforce crisis and bed crisis, you know, those things are real and impact on the youth quite a bit.
Well, I thank you both and thank Rob for answering, you know, the question. Like I said, just something I just wanted to bring up and Lynn, thank you for, you know, reaching out children.
Just a quick comment.
It's just hurts the heart when you hear this. Thanks.
All right, Supervisor
Yeah,
McDevitt.
just a quick comment. It seems to me a real crisis that's occurring nationally is the shootings that occur almost on a daily basis throughout the country. And it just, you know, I sit there and I observe this and it's like there's no answer. Okay, it's like a riddle. How does it even begin to occur? I mean, all over the country, literally every second or third day, there's a shooting. Just what's going on?
Yeah, I mean, it's tragic, you know.
Any other comments? All right, then I guess we're all set. Thank you very much, Rob.
And Linda walked in just a few moments late, but I didn't know it related to the respite. If there were any other questions, Linda's really our expert on that and manages the whole process. So if there's any other questions.
She's here to answer them for us. Anybody have any other questions? Oh, okay.
All right.
All right, thank you. Thank you
Thank
for all
you.
the hard work
Thank
you do for us, Rob. We appreciate it.
Thank you.
Nice meeting you, Linda. Good morning, Janelle. I know you're there.
Good morning, everybody.
Good morning.
So our first resolution request is to authorize a contract with Maggie Wood, who's an occupational therapist doing business as Maggie Wood, to provide Committee on Preschool Special Education Services to eligible children in Warren County at the New York State approved rate. CPS service providers are desperately needed to ensure the availability of service for our eligible children in the CPSC program. And these services are eligible for 59.5% reimbursement through New York State.
All right, would someone like to bring that motion to the floor? Supervisor Hogan, seconded by Supervisor McDevitt. Any questions for Janelle? All right, we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
The second request is also to authorize a contract with Maggie Wood, an occupational therapist, but this is to provide services through our certified home health agency at the established rates. Our CHA also needs therapists to ensure services are available to our home care patients. Reimbursement is variable depending on patients' insurance coverage.
All right, would someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Beatty. Any discussion on that? All right, then we'll vote on that. All those in favor? Aye. Opposed? Carried. Thank you.
Resolution number 3 is to authorize a contract with Gail Piscothi. She's also an occupational therapist doing business as Gail Piscothi to provide committee on preschool special education services to our eligible children in Warren County at the New York State approved rate.
All right, would someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Hogan. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you. Janelle, number 4.
Resolution number 4 is to authorize extensions of our current 2022 intent to fill forms, authorizing to fill the vacancies below. So all these are our open positions needing to be filled. Health Services has vacant positions that are desperately needed. Nursing salaries are revenue generating. The department needs the availability to hire the applicants as they become available. This reflects 14 vacancies, 2 of which are newly created positions of public health in 2022. 2 are retirements, 1 in 2021 and 1 in 2022, and 10 are due to resignations. Of the resignations, 8 were in 2021, mostly due to higher paying jobs elsewhere. We also found that COVID and the stress of COVID and the pandemic also contributed. While salaries need to be addressed across the board, nursing salaries are in critical need, which unfortunately is dependent upon the CSEA contract and the reallocation process of which we're part of and in support of. Just worth noting, the infant feeding advocate, fingers crossed, I think we have a candidate for that position, but I want to go ahead and put that through in case something falls through. I have the ability because we did have a couple other interested people in that and we could move forward.
All right, would someone like to make the motion to authorize the extension of the current 2022 intent to fill list? Supervisor Hogan, seconded by Supervisor McDevitt. Any discussion? Supervisor Hogan.
Is there any value in this committee generating a letter in support of the administration and the personnel committees of advancing
Did you hear that, Janelle?
negotiations on salaries? Is there any value in that? I mean, do we need it? You know, clearly something needs to move. What can we do to help it move?
Well, my understanding is unless the contract is open or unless these positions are approved through the reallocation process in agreement with the union, that there's really nothing that the county can do. I know that Ryan, our county administrator, and the board, and I know HR and civil service are all in support of looking at salaries, but my understanding is, you know, it's the union, you know, that we're waiting on to kind of formalize that process. I definitely would appreciate any support if something comes to a vote, but I'm not so sure we have the power to do anything unless we take our nurses out of the union.
Okay, Mr. Moore.
Thursday and Friday last week, we did speak with the union and we'll be moving forward with the union.
Can you give us more details on what that looks like?
They have made a request that we will need to negotiate.
So what's the next step?
We need to negotiate.
Right, but how do you schedule bringing everybody to the table? I mean,
They have a negotiating team and so does the county, and we will schedule whenever works for both teams.
And do you have proposed dates yet?
Not yet.
When will you have proposed dates?
We will need to meet internally first, and then we will get proposed dates.
So when will you meet internally? Thank you.
Supervisor McGowan.
Thank you, Chairman. I like the idea from Supervisor Hogan. I mean, it wouldn't hurt just to put a letter in towards the negotiating team coming from our, from your committee. I mean, it would help keep the pressures on. You know, it was quite a, you know, that was another heart-wrenching part of the meeting there last week. You know, to hear some of the stories, but, you know, we have been trying to work on this for years. So I hope we stay on it, you know, every day. And have, but I would like if the committee could, you know, put a letter toward the negotiating team to help out, you know, our nurses and probably bringing this up to Chairman Driscoll here to do it for the DDS too. So.
I don't see any reason why we can't do that, so we can
Thank
definitely
you.
work on it. Supervisor Driscoll?
Yeah, thank you, and thank you, Mr. McGowan, for reminding me of that. But I think that it's an excellent idea. I think, though, that we need to be consistent with, if we're gonna write one letter, we've got to write a letter to each and every department that has union employees in it, because you know, talk is quick on campus. So you don't want anyone to feel slighted or that another department is getting preferential treatment, or we're more focused on their needs and desires than another. So I think it's an excellent idea as far as writing the letter, but at the risk of minimizing the letter, I would suggest that it be a generic letter to all departments. Just my thoughts.
All right, thank you. Yes, I thought I saw your hand, Supervisor Leggett.
Yeah, thank you. And just for clarification, the nurses are under the CSEA contract.
That is correct.
Right. All right, anyone else? All right, let's vote on this authorization. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Janelle?
All right, next is our information for discussion and review. They're all of our regular attachments. I'll have Ton go over our report of expenditures and our comparison report, which are attachments 5 and 6.
All righty.
Attachment 5, which is our financials that were as of June 9th. You'll see we had closed at the time, April I had accrued, so we just closed May, but those figures are not in here. They'll be in the next meeting. Just for comparison, again, when talking about salaries, it's so obvious. When you compare last year to this year, you can see we're right now at 23.29% of our budget. And last year at this time, we were at 40.48%. One thing to know, obviously, is the overtime is almost 70% down from last year. And a lot of that had to do, obviously, with all the COVID and related time that's spent there. And same with the part-time salaries, because we had to hire a lot of part-time to get through, again, the COVID. Our contact tracers were considered part-time. And also we had to hire part-time nurses to help with clinic. Regular salaries is down, and then is the openings that we were talking about that we've got. And on the next page, which is attachment 6, again, nothing really major to discuss. The one thing is just equipment looks a little bit down this year because we got vehicles by this time last year. We're in the process of getting a new vehicle for our departments this year. We're getting 1 vehicle, we're trading in or getting rid of 5 vehicles, I believe. The other thing is our contractual expenses. Again, that tends to be our preschool program, just due to timing again of invoices compared to last year. But by the end of the year, we'll all be caught up. But that's down about $500,000. And of course, employee benefits are down, and that's all related with our fringe, with all the salaries that we are not paying for, therefore the fringe is lower. So, overall, that's our expected, where we stand right now with the revenues and expenses.
Thank you. Any questions for Ton? No, we're good on that. All right, thank you, Ton.
You're welcome.
Neil, back to you.
We have our regular other attachments. I was just checking, I believe we've got a rabies clinic coming up that's listed on our rabies program report, and it is at, let's see, July 16th in Chestertown. We have a clinic, and August 13th at the Queensbury Community Center. Otherwise, if anybody has any questions, we'd be happy to entertain those.
All right, committee members, any questions? Anyone in the audience have a question? If not, I guess we can entertain a motion to adjourn. Supervisor McDevitt, second by Supervisor Hogan. Any discussion? All right, all those in favor? Aye. Thank you very much, Janelle. Enjoy the